Lynn, ABN News has talked to several members of the arthritis community, and they spoke about the need for a national framework. What is a national framework, and how would that affect arthritis?
Well, I think the arthritis community is recognizing that it is going to be successful in getting those policy changes made that are required to improve the treatments available and the supports for people living with arthritis. They are going to have to come up with a concise, coordinated initiative called a framework, which will incorporate not only information on the seriousness and the impact of arthritis, but also address those changes that are specifically required and will have the most impact in improving the lives of Canadians with arthritis. In the framework so far, if you would like me to continue, they are really looking at three initiatives. They're looking at how research can be improved because arthritis affects well over 4.5 million Canadians, but we don't know what causes it. We don't know how to improve it. We do have treatments, but we still have a long way to go. We recognize that arthritis research needs to be better coordinated, and there needs to be much more support for it if we are going to improve. We talked a little bit about models of care, and that is a major thrust of the framework, that the sense is that the people who are delivering arthritis care and the people who live with arthritis are the best ones to come up with those ideal models of care that we can then recommend to governments and to the healthcare providers associations to implement. The last initiative that really is the major thrust within the framework is the awareness initiative, and that is really to help improve people's awareness of arthritis. If you don't know what arthritis is, you're not going to suspect you have it if you know about it with the symptoms. If you don't know what the symptoms are, or your doctor isn't familiar with arthritis, you're not going to get diagnosed. And we all know that early diagnosis and prompt treatment is an effective way of lessening the impact of the symptoms and slowing the progression of arthritis. So awareness, both for the general public, but also for people affected by arthritis, is critical.
So the national framework, this is not just a federal initiative, but the provincial governments who I guess are responsible for delivery, they're real key players as well.
Yes, I think that the framework is really being primarily targeted to the federal government, but we are going to have to reach out to the provincial governments. They are responsible for the delivery of healthcare, but it's also going to have to, I think, reach out beyond governments itself to the other groups that are very key in making healthcare delivery and healthcare planning decisions.
So 4.5 million Canadians living with arthritis, that's a big, powerful constituency. How can people get involved in this quest for a national framework?
There's many ways that they can be engaged. I can speak most knowledgeably about the Arthritis Society, and we do have an advocacy initiative where we encourage people to self-advocate. It's very important for people who directly experience arthritis, whether they have it or whether they have a loved one or even just someone who is in their social network, to write to their elected politicians and to let them know that arthritis is important to them. Your elected politician, is really responsive, but they are not going to address an issue if they don't know it's important to their constituents. They can also work through the Arthritis Broadcast Network, which is going to have, I think, many opportunities as it grows and develops for people to engage and to tell their stories. So it's to reach out, and through any of the members of the Arthritis Alliance, they can become more engaged, whether it be volunteering, telling their stories, or getting out to show support when there are initiatives.
Great. Thank you very much for joining the ABN News today.
Thank you so much for having me.
Thanks, Lynn.